Good morning, students. Good morning. Myself, Azif Muhammad Arif, and I am from KIAMSnext.com, Indian Medical Coaching Institute from India. We are glad to see you again and will be delivering FMG session today for, for BIMI. Thank you. Dr. Khalilullah Khan sir will be continuing from here. Thank you.
Good morning, everybody. I am Dr. Muhammad Khalilullah Khan. For all those who do not know me, I have been taking classes since last 12 years, and this is my second class here. And this is just an introduction and orientation to how questions are asked in FMG screening test. All right. In my last class, I told you different topics. In that, I discussed how to approach the subject. Is it not? I'll continue the same scenarios here, clinical scenarios here. See, we'll start with cardiac cycle. You start with cardiac cycle with anywhere of the cardiac events. The heart is contracting and relaxing. That is a basic, that is a basic steps which we are dividing the entire cardiac cycle. If you go deeper into it, atria is contracting separately, ventricles are contracting separately. Atrial contraction, I am not calling it as systole, though it is called as systole, but I am not calling it as systole because our understanding will take a downfall if you call it atrial systole and ventricular systole separately. I will call it atrial contraction is atrial contraction only. There is nothing harm in calling like that because it will get confused with ventricular systole. So what happens is once there is atrial contraction, atria is full of blood. Atria matlab hai right atrium and left atrium. Okay, combined atria I am calling it, plural. All right. Right atrium and left atrium are having blood received from venous return and also from the lungs, oxygenated and deoxygenated blood. Now the atrium is having blood. Atrium has to contract. The atria are contracting, atrial contraction. Once the atrium contracts, the blood from the atrium is received by the ventricles. Okay? For the blood to go into the ventricles, the valves should be open. These valves are atrioventricular valves, AV valves. Valves are nothing but the doors, like the door of this room. Okay? There are two types of valves. On the right side, we have tricuspid valve. On the left side, we have bicuspid valve or mitral valve. Okay? The tricuspid valve is guarding the entry of blood into the right ventricle. It is one-way flow. It's a one-way door. You remember what is a one-way door? Some doors will open if you go to some shopping center. They open both the sides. But one door is opening only on one side. It is only opening on one side and close with the help of spring mechanism. We have doors like that. Is it not? Similarly, our valves are also like that only. They allow the entry of blood. They allow the entry of blood from top to bottom like this. From top, that is the atrium into the ventricle. So at the same time, atrium is contracting. Contraction of the atrium triggers the opening up of the valves. Opening up of the valves, and 30 to 40% of the blood only is reaching the ventricles. After that, what happens is the ventricle which already had some blood, only 30% of the blood is reaching the ventricles. Now what will happen is because the pressure inside the ventricle increases. Say suppose we are sitting in this ventricle, the pressure here is increasing. The pressure here is increasing and it closes the door. Okay? The pressure here is increasing and it closes the door. Alright? So if you can follow this, the atrium is contracting here. The atrium is contracting here. And then the blood is received in the ventricle. 30% of the blood flows into the ventricle. It is enough to close the door, to close the valves. Now the valves are shut. Now these valves are shut. Alright? I'll draw a simple diagram again because this step understanding will help you to understand the heart sounds and murmurs and also cardiac diseases. That's why I'm spending a lot of time here. Alright? The next step becomes very easy if you understand this. So I'll draw a diagram here now. Say suppose this box is representing the heart. Alright? On the right side we have got tricuspid valve. On the left side we have got mitral valve. All right. So the blood now is flowing from this direction to this direction like this direction to this direction like this. All right. This has got, the right ventricle has got an exit major trunk, major blood vessel called as a pulmonary trunk. On the left side we have got a major exit, a major artery called as the aorta. The blood flow into the pulmonary trunk and the aorta is guarded by semilunar valves. Semilunar valves. So we have got semilunar valves here. Okay? These are already closed. Till now what happened? 3 steps. Atrial contraction, ventricular filling, closure of the AV valves. These were the 3 steps I told you just now. I told you that first the atrium was contracting. Second, I told you that movement of the blood into the ventricles. Third, I told you that there is shutting of the doors, closing of the doors. Sir, why did the doors close? Because of increase in the pressure inside the ventricles. Ventricles. So the door closed. Alright. Now the ventricle has got 2 doors. Entry of blood is through the atrioventricular valves. Exit of blood is through the semilunar valves. Okay? Entry and exit, 2 doors. Entry is not allowing exit. Entry has got a separate door, and exit has got a separate door. You enter from this door and go from somewhere else like this. Alright? Both the doors are closed. Both the doors are closed now. Ventricle is full of blood. Both the doors are closed. Now the ventricle starts contracting. Now the ventricle is starting contracting. Sir, why is the ventricle contracting? Why should the ventricle contract? Because it has just now received the electrical stimulation, electrical conduction. From where? From the SA node to the AV node to the bundle of His to the right branch to the left branch of the bundle. So first the current goes to the left branch, then after a few milliseconds it goes to the right branch. Both the ventricles are contracting as a closed chamber. So we are calling this as isovolumetric contraction. Iso matlab same, volume matlab volume of blood, contraction is contraction. Isovolumetric contraction. Ventricle is contracting as a closed chamber. Once the ventricle contracts as a closed chamber, it overcomes the pressures in the aorta and pulmonary trunk. See the aorta and the pulmonary trunk. The valves are closed here. Okay, what is the name of these valves? Semilunar valves. Semi means half. Lunar means what? Moon shaped. So semicircular valves. Actually, these are semicircular valves. Pulmonary valve and the aortic valve. Okay. So this ventricle is contracting as a closed chamber, and this is opening up of the valves result in gush of blood now from the right atrium to the right ventricle. Now the blood is going to the pulmonary trunk. From the left atrium to the left ventricle, now the blood is going to the aorta. Now the blood is going to the aorta. Alright, did you understand this? Once the blood reaches the pulmonary trunk, once the blood reaches the aorta, what will happen to the door? Again the door shuts. Why? Because there is now the high pressure which was there in the ventricles now getting transferred into the aorta and pulmonary trunk. So very high pressure here again closes the door back. One-way door. I told you it's a one-way door. One-way door. Wherever the pressure is high, if preceding chamber the pressure is high, it is opening. If succeeding chamber, that is afterwards, whatever is the chamber, the pressure is high, it is closing. Closing. So again I will start the story. Atrial contraction, ventricular filling, closure of the valves. Ventricular contraction, opening of the valves, aortic filling, then closure of the semilunar valves. 6 steps I told you. Okay? 3 here and 3 here. Alright? So what's happening here? After atrial contraction, the atrioventricular valve is closing. The closing of the valves produces a sound called as lub. Alright? Then what happens? There is ventricular contraction, systole, ventricular systole. After atrial contraction, there is ventricular systole. Ventricular systole is responsible for opening up of the valves at the end of the systole, not at the beginning. At the end of the systole, what will happen is the blood is flowing. Imagine it will take some time, is it not? 0.5 seconds, 0.8 seconds. Some blood is flowing like this. And once this 70 ml of blood, whatever is there in the left ventricle, if it reaches the aorta, it increases the aortic pressure. What is this aortic pressure also called as? It is nothing but your blood pressure which you are recording in the brachial artery. Systolic blood pressure, whatever you are recording here, that is the pressure here, 120 mm of mercury, normal pressure. So, once this reaches 120 mm, we have got left ventricle which has emptied. So now this high pressure in the aorta closes the valves. Closure of the semilunar valves produces the second heart sound, that is dub. Lub, dub, lub, dub, lub, dub. What is coming after lub? Systole. What is coming after dub? Diastole. Relaxation. Diastasis means relaxation. Diastole. Got it? Got it? So what will happen is, once there is first heart sound, can I tell that first heart sound remarks the opening or beginning of the systole? Yes. Can I say that second heart sound remarks the end of the systole? Yes. And the beginning of the diastole? Yes. Got it? Then after second heart sound, we hear again first heart sound. What was it? This was the systole of the next cardiac cycle. First heart sound, second heart sound, first heart sound. So first heart sound to second heart sound was the systole of this cardiac cycle. Second heart sound to another first heart sound was the diastole of this cardiac cycle. This S1, the next S1 was actually beginning. It was marking the beginning of the next cardiac cycle. Next cardiac cycle. Did you understand this? S1, S2, lub, dub, lub, systole, dub, diastole, lub, systole, dub, diastole. This is pro level of understanding. In clinicals, you understand it like this. You integrate the physiology with clinicals now. Now let us try to understand what are the different heart sounds. What are the abnormalities of the heart sounds? Just by seeing the heart sounds, we will try to diagnose certain diseases. But for our understanding, let us see lub or the first heart sound. Lub or the first heart sound is actually a property of atrioventricular valves. Atrium, ventricle, atrium, ventricle, atrioventricular valves. So the first heart sound is a property of atrioventricular valves. Any disease of the atrioventricular valve may result in abnormality of the first heart sound. True or false? True or false? True. So any abnormality of the atrioventricular valve, or I'll repeat, any abnormality of the tricuspid valve, any abnormality of the mitral valve may interfere with the character and intensity of the sound of the first heart sound. Got it? Instead of lub dub, lub dub, lub dub, it may become dub, 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 something like this. Got it? How to differentiate this, I'll tell you later on. How to say that, sir, when I put a steth, how to say that this is first heart sound, this is second heart sound, I'll tell you later on. In this class only later on. Alright, it requires some more understanding. So now what's happening is, say suppose we have got ventricular hypertrophy, stiff ventricles. Say suppose this ventricle has a hole. This ventricle has a hole. Say suppose, I'm talking about different diseases in the heart. Say suppose this ventricle had a hole. After first heart sound, instead of blood going into the aorta, it might go into the right ventricle. So there is a left to right shunt. In certain diseases, there is a hole in the interventricular septum. These are the congenital heart diseases. The development of the septum is not proper. Septum develops in two halves, two parts. The lower 2/3 is muscular septum, upper 1/3 is a membranous septum. In the membranous septum, sometimes there are holes, most commonly. And this is the most common type of congenital heart disease which I am talking about. From the left side of the heart, at the time of isovolumetric contraction, instead of blood going into this door, I told you there is only one exit door, but now there are two exit doors. One is aorta, which will receive less blood. Half of the blood or 1/3 of the blood goes in the ventricles. Ventricle was not prepared to take the new guest. The right ventricle was not prepared. Right ventricle was very happy with deoxygenated blood. Small amount from the right atrium into the right ventricle into the pulmonary trunk. And pressures in the right heart is always less than the pressure in the left heart. But because of this ventricular septal defect, what's happening is the pressure of the right side increases. the pressure on the right side increases. All right, this increases right ventricular pressure. Now this is the muscle, it is receiving a lot of pressure. You go to gym and you lift a heavy weight. What will happen to the muscle? What will happen to the muscle? Undergoes hypertrophy, increases in size. Hypertrophy, it gets pumped up, or it becomes larger in size. Is it not? Hypertrophy. So heart is also a muscle. It is receiving extra blood from the left side into the right side. What will happen to the right ventricle? Very good. So one of the most common pathologies associated with ventricular septal defects is right ventricular hypertrophy. Because of this right ventricular hypertrophy, high pressure was there in the ventricles. Now high pressure will go into the pulmonary trunk. If high pressure is going into the pulmonary trunk, it results in high pressure means what? Hypertension. All right, hypertension. We have got two types of blood pressures. The blood pressure on the left side and blood pressure on the right side. Blood pressure on the arteries and blood pressure inside the veins. All right, the blood pressure inside the arteries we are calling it systemic hypertension or systemic arterial hypertension. The blood pressure inside the veins you are calling it as systemic venous hypertension, or because we are talking about high pressures in the pulmonary trunk, can I call it pulmonary arterial hypertension? Yes. So another disease we are talking about now is pulmonary arterial hypertension. Because more and more blood was flowing across the pulmonary valves, what will happen to the heart sound, second heart sound here? It becomes louder, loud P2. A loud P2. P2 is pulmonary second heart sound because of pulmonary valves. A2 is second heart sound because of aortic valves. So P2 is loud here. Sir, why P2 was loud here? More and more blood was flowing. Sir, why more and more blood was flowing? Because of a hole here, because of a defect here. Where was the defect? In the interventricular septum. There was a defect in the interventricular septum. And now I'll again tell you entire chronology. Interventricular septum defect, that is ventricular septal defect, results in movement of blood from the left to right. We call it left to right shunt. Because of this, what happened to the right ventricular pressure? Please answer. Increased. Because of high pressure, what happened to the muscle? Very good. So right ventricular pressure increase result in right ventricular hypertrophy. Then what happened to the pulmonary arterial pressure? Increase or decrease? Increase. What is this condition called as? Very good. Pulmonary arterial hypertension. How do you diagnose pulmonary arterial hypertension? But just by putting a stent. Loud? What loud? First heart sound or second heart sound? Second heart sound. Which component of second heart sound is loud here? Aortic component or pulmonary component? Very good. You have diagnosed one of the most difficult, two difficult topics in cardiology just by understanding physiology. This is the importance of physiology. Okay? If you go into final year, open the clinical books, there it will be written pulmonary arterial hypertension, loud P2. उस time पे आप क्या करोगे? You will mug it up without any understanding. You try to read it 10 times. Sometimes some students, what will they do? How to increase your knowledge? Do you know in medicine? In MBBS, how to increase your knowledge? Do you know? If you really want to increase your knowledge, what you should do is take that book, keep it under your pillow, and sleep. All right? There is transfer of knowledge. That will never happen. You have to apply. You have to apply your basic sciences. You have to apply your concepts everywhere. See, the beauty of medicine is it helps you understand the topic. If you understand the topic, you will remember it for a very, very long time. Your lifelong if you apply it. And if you mug it up, you will never, your life will become more miserable than it was before, right? So whatever it is, let us quickly now try to understand the first heart sound, second heart sound and abnormalities with another diagram now. With the help of another figure, I will show you. Now please follow this. We are going into level 3 of understanding now. Alright. So level 3 is something like this. Say suppose this is the timeline of cardiac cycle. Alright. Timeline of cardiac cycle. This is the first heart sound S1. This is the second heart sound, that is S2. It has got two components. It has got two components, A2 and P2. It has got two components. All right, A2 and P2. All right. First heart sound is because of closure of the aortic and atrioventricular valves. Second heart sound is because of closure of aortic and pulmonary valves.